In this module, you will learn about the peer check-in structure, which you will use after the first check-in for the remainder of your weekly check-ins with your mentee. It's important to follow this structure because it will help you to stay focused and enable you to support your mentee the best way you can. The peer check-in structure is based on 4 steps that guide you to have a good conversation with your mentee. On this slide, you can see the steps and examples of what a peer mentor can say for each step. The first step is to pick the right time and place. Even though you have scheduled this beforehand, stuff comes up, so you want to make sure it's still a good time with your mentee when you call or text. When you first reach your mentee, you can ask them, is this still a good time? It's okay for them to say no. If it's not a good time, then ask them when they want to reschedule. Trying to do a check-in when it's not a good time may not lead to the most successful check-in. If it is a good time, you want to see how things are going with getting ready for the treatment or taking the treatment. For this step, it's really important to evaluate their situation. Really listening to someone is a true skill. We're often so focused on what we want to say that we don't listen to the other person. For example, I as a peer mentor may be really interested in talking about taking my medications on time, but if my mentee is talking about the fact that he's hungry and he hasn't gotten any money to pay the rent, then this conversation is going to go nowhere. If your mentee is bringing up things that are showing you or telling you that he is not really able to focus on taking his medication or talking about taking his medication, it's okay to kind of attend to him and say, I hear what you're saying. I'm sorry that you have not gotten your check this month. I hear that you're hungry. I can talk with my research coordinator about what it is that we can do to possibly help you. We also want to show people that we're listening by, if we're doing a video chat, really making eye contact and nodding, or if we're on the phone, not being distracted by other text messages, and by commenting as they're talking by saying, okay, I hear you, Moving on, the next step of the peer check-in structure is to help explore their options. As peer mentors, our job is not to point out what they need to do. People don't like being told what to do. Our job is to point out options that are available to them and asking them, what are they willing to try? By using the frequently asked question guide, peer mentors can offer options to participants if they're experiencing challenges to remembering to take their medication. For example, a peer mentor could say, would you be willing to try a pill box? Would you be willing to try putting your pill taking into your calendar or into an alarm clock? Doesn't that sound better than you need to use a pill box, or you need to do this, or you should? Nobody likes to be told what to do. As peer mentors, we're not trying to fix people. By offering them different options and letting them choose, this takes the weight off of our shoulders as a peer mentor and allows our mentee the time to be able to decide what works best for them. Lastly, the final step of the peer check-in structure is resources. And this is the step of the check-in where you yourself, as a peer mentor who has experienced hepatitis C infection, who has gone through the treatment and the cure, can use your experiences to help relate to the participant and provide validation and motivation of their experiences. As peer mentors, we say, based on my experience, I was also nervous about taking the medication, but when I learned that I could be cured and my liver could be saved and start regenerating, I decided to talk more with my doctor about the concerns that I had. There's more information in the peer manual about ways that you can tell your story so that you can be the most effective peer mentor without sharing too much or violating any aspects of privacy or confidentiality in your own situation. On this slide, you can see examples of how you can use the peer check-in structure at the different stages of the program. For example, in the first video check-in of the of the program, you will still ask, even though it's been scheduled, is this still a good time for you? Remember, your mentee will have just been told their HCV status and may not be wanting to talk about this. To evaluate their situation during this first check-in, you might ask, how are you feeling about the test results and being in the study? To explore their options, you might ask, are you willing to have check-ins with me? Would you prefer to do it over text or over phone? And finally, with regards to resources, you could tell them or share with them, that again, you were first scared, but that you were excited to learn that you could be cured. When your mentee moves into the pre-initiation stage before they start taking the medication, you of course still want to ask over phone or text, is this still a good time? And then to evaluate their situation, you want to ask about whether they've had their blood work done or their labs, whether they've talked to the doctor, and if they are eligible to take the medication, have they picked it up? To explore their options, this is where you can really focus on not only them taking their medications or getting ready to take their medications, but also focus on their harm reduction behaviors. So you could ask them, what are some options for you for remembering to go to your appointment or getting to the clinic? Do you have options for transportation? Is this a challenge? And lastly, with regards to you as a resource, you can ask or share with your friend, share with your mentee, that your experience of how it may have been helpful that you had your friend or your partner or a family member go with you to the clinic as you were preparing to take the medication to get cured. Once they start taking the medication, you really want to focus on their adherence. How's it going? What are the problems you may be experiencing? Have you missed any doses? If they have, what are the options that you can offer them so that they can remember to take the medicine as prescribed, which is 3 times a day. You might want to share with them as a resource what's helped you remember to take your medications, whether it's the hepatitis C medication or medication for your diabetes or your heart condition. And finally, once they stop taking the medication, they have completed their 8 weeks of medication treatment, you should be checking in with them on how is it going. And I want to stay in touch with you for the next 14 weeks because we will learn in the next 14 weeks whether you have sustained the cure. And finally, sharing your resources about ways that you've avoided reinfection and strategies that you have used to reduce risks of reinfections, either between drug use or drinking alcohol or whatever. Before you do your check-ins, whether it's on phone or video chat or even text, it's really important that you are prepared. Make sure you have your peer mentor manual with you with the frequently asked questions section opened up, and that you're in a quiet and private space. This is important to reassure the mentee that your conversation is confidential, and if they have questions or issues, that you have the resources available to answer them. You will have received a booklet of weekly check-in sheets, and each week you will document every attempt and contact you've had with your mentee. This is a very essential and important task as a peer mentor because it helps us keep track of your interactions with the mentees. It also allows us to pay you for the interactions. When your mentee has not started the hepatitis C treatment, this will be filled out in the pre-initiation weekly check-in. After your mentee has started the hepatitis C treatment, this will be filled out on the post-initiation weekly check-in. At the end of each week, you will hand in this sheet to your supervisor, and we will provide a video showing how to properly fill out these sheets in the booklet. In addition to filling out the week of the check-in, your mentee's name, and the date and time that you attempted contact with them, we want to make sure that you also record the reason that you were contacting them, what happened as a result of the contact. And so, for example, if you contacted them 3 times via cell phone and only got a voicemail and left voicemails, that's important for us to capture. The notes section is really for you to indicate anything notable about the call. So it might be that for attempt 1, you tried to call them just for the weekly check-in. There was no answer. You left a voicemail. Attempt 2, you did the same thing. You left another voicemail. Attempt 3 for week 1, you were able to talk with your mentee, and one of the things they told you was that they were sick because of they had a flu. They got sick from a flu or were experiencing allergies and hadn't been able to make it to the doctors yet to talk about their lab results. So you would want to indicate in the notes section, talked with mentee, they said that they had been sick and have not yet gone to the doctor to talk about their lab results, but still intend to make that visit.